Now to the next, where I believe Deputy Pat Casey and Deputy Mary Butler are sharing their 10 minutes. Is that correct, Deputy Casey?
Thank you, Count Corla. Listening to the debate on mental health services in Ireland, I have been impressed by the unity of purpose and the sincerity of all deputies that this is a problem that needs a continuous national response by the government at national, at local level, by non-government actors such as community and voluntary sector, and indeed by the wider society itself. Mental illness is widespread, and there is not a family on the island that has not been affected by seeing a loved member struck down by one of the range of conditions of the mind. In too many instances, these conditions have resulted in the ultimate despair, a death by suicide. Suicide is not a choice. It's not a failure to adapt. It's not giving up. Suicide is the terminal stage of mental illness. My colleague Robert Troy has bravely and movingly put into words the crippling physically and emotional symptoms of mental health. I, along with all here, wish him well in his recovery and thank him for the public service of sharing his story. How we conduct our political and public lives must become an example of creating a society that is respectful of the truth, and no matter what walk of life we are in, what differences exist between us, that we are all human beings on the journey of life. Too often I have turned on the news to hear the latest Dail report, to see supposedly adult politicians shouting insults at the other side and exercise in personal point scoring. Passionate debate is welcome and is to be encouraged, but all those involved in public life, particularly in politics and in the media, have an extra duty to do so in a way that shows respect for difference and that informs fellow citizens of the complexities of our problems, not just jargon-driven but shallow headlines. Our mental health crisis is a symptom of the society that we create and will only become greater unless we also begin to see prevention as equal to curative measures. Mental health must become a major health initiative of the Department of Health and the HSE on parallel with cancer and heart disease. It is only that type and depth and breadth of focus that will allow mental health the priority it clearly deserves. Our modern society is too self-obsessed with perceived winners and losers. Too much is black and white, while in truth shades of grey are often the case. Our society is also increasing in the pace of life, the race to find the right school, the points race, the right college, the perfect job, the perfect partner, the perfect house. In short, the illusion of the perfected life. And these are all sold via a consumer society that only portrays a shallow view of perfection that is unobtainable in my view, and is a contributing factor to the strains on our mental health. A positive and preventative approach is also a vital pillar in any coherent delivery of mental health strategy. In that regard, young people and men are two groups that need to be targeted by a holistic plan that empowers them to be partners in the maintenance of good mental health. In that regard, I have been highly impressed by the Jigsaw project, which has emanated from the Headstrong initiative. This project is in fact a network of projects designed to ensure that every young person has somewhere to turn to when in need. Jigsaw does this by having centres in hub areas and pop-up clinics and centres to ensure that the hard-to-reach young people have relative ease of access. They have recently managed to provide this service throughout the county of Donegal, and it is my hope to determine that they can provide that county-wide service to Wicklow and East Carlow. While the HSE is the main funder, a holistic and mental health programme for young people must involve the Department of Education and each local authority. And I am pleased to report that Wicklow County Council, along with Brave Partnership, are working to establish a Jigsaw service for Wicklow, and they can be assured of my support. But I must insist that this programme is rolled out beyond the major centres of Bray and Greystones, and it must reach down into the smaller towns like Wicklow, Arklow, Blessington and Bostonslass, and to the rural area where mental health issues are escalating at alarming rates. Purposeful mental health service for everyone, and the beginning of the end of this silent suffering can be the lasting legacy of this Dáil. I hope that as elected representatives who are in very close agreement on this issue, that we can achieve this early in lifetime of the House. This would be a real signal to the naysayers and the doubters that politics can be a force of real and positive change. I, for my part, will lead by example. Thank you.
Thank you very much. And you're leading by example with your timing as well.
Thank you.
Deputy Mary Butler.